heartily welcome you all today for this exclusive webinar. Namaste. I am Dr. Anu Vashish, Membership Director at Cynodent. Today, I am hosting the webinar with Dr. Misbah Qadri, who's Social Media Director at Cynodent. I would like to thank the founder and CEO of Cynodent, Dr. Anmol Bagadia, and Team Cynodent for organizing this webinar. Cynodent is a global healthcare platform for all. First of all, let me introduce Cynodent. Cynodent brings you Cynodent International and Cynodent India. Cynodent is a unique international digital healthcare platform, first time in the world. Revolutionary change brought in India by bringing a digital healthcare platform that will provide and enhance a good relationship between patients and doctors and enable a real-time appointment scheduling system. Our goal is to create easy and fast access to healthcare services. Cynodent is here to create precious healthy smile on patient faces and always with minimum efforts and maximum welfare. Cynodent International has brought for you research cell, block section and educational programs for doctors to enhance their knowledge, skill and keep them updated regarding recent advances and latest treatment developments. We are currently doing free webinars for students, dentists, senior practitioners from India as well as across the globe, which are different from the webinar era going on. Cynodent is also working for social welfare and humanity to enhance the quality of life by providing healthcare needs, healthcare awareness, and free treatment. So let me introduce you our speaker for today, Dr. LIVIU STEIER. He has been practicing dentistry in Germany for over 30 years. He's a specialist in prosthodontics and in endodontics with a host of both research and practice experience spanning over 30 years in both US and Europe. As part of his work, he has served as clinical and course director at Warwick University in Coventry, England, as member of faculty of dental surgery at Royal College of Surgeons in Edinburgh, Scotland, as course leader MSc's program at University of Manchester, England, and as visiting professor at University of Florence, School of Dental Medicine, Italy, and at Tufts University School of Medicine in Boston, MA. Dr. STEIER serves currently as adjunct professor at University of Pennsylvania Dental School in the Department of Preventive and Restorative Sciences, Robert Shatner Center, University of Pennsylvania School of Dental Medicine. In the US, he was appointed a scientific advisory board member for the Journal of Endodontics, and he has served as editor-in-chief and reviewer of multitude of peer-reviewed journals, including Journal of Dental Education. He has also been long-standing member of American Academy of Periodontology and the American Association of Endodontists. Dr. STEIER is an internationally recognized lecturer known for his hands-on teaching style, innovative spirit, and both his breadth and depth of knowledge. He has co-developed several breakthrough technologies in caries detection, prevention, and therapy. His award-winning work and numerous publications have been distinguished by authorities in the field around the globe, and he continues to make outstanding contribution in both practice and scholarship that have been received widespread acclaim by clinicians and scientists across the board. One of his recent webinars had nearly 20,000 views at a time. So I would like to welcome you, sir, and extremely sorry for your pronunciation.
Thank you very much. Thank you very much for the introduction. You made me blush. By the way, Thank you very much. I appreciate. I would like to say good morning, good afternoon, good evening, wherever you are on this planet Earth. I hope Mr. COVID was kind to you. If not, please send him away. I am delighted and honored to have the chance to talk to you today and to share this presentation and this knowledge. Yes, hypochlorous acid in clinical practice. Why hypochlorous acid? I am sure some of you may have heard about, some not. So whatever it is, hypochlorous acid and myself are long-standing friends. Our friendship was probably first made public in 2006 when I had the honor to lecture on the topic of novel irrigants for root canal disinfection at the first Roots Summit in Amsterdam. And yes, since then, this friendship continued and is still there. Hypochlorous acid was discovered a couple of days ago in 1834 by a French chemist. And again, why hypochlorous acid? Is that at all a relevant product? Why is it relevant for dentistry? So yes, you will be surprised, especially today in these pandemic days. Hypochlorous acid has been underappreciated and not well understood, and sadly also not well used. Hypochlorous acid is an antimicrobial, antiviral, and antifungal that is non-hazardous for any mucosal contact. And this is the key information you will have to take home, please. We will discuss today surely science, generation, applications, and benefits. And please, of course, I'm sorry, there will be a little bit of science, but you will understand. I want to introduce you to a new friend. So hypochlorous acid is indeed one of the most effective known biocides. And guess what? Exactly. It is produced by the human immune system to kill invasive organisms and fight infections. So it is produced by ourselves. It cannot be harmful. And it can be produced, manufactured. So let's see a little bit more about that. So when a wound breaks human skin, for example, due to infection, of course, neutrophils, which are type of white blood cells, okay, they will induce a process of phagocytosis. And they will produce an oxidant, which is what? Exactly, hypochlorous acid. Hypochlorous acid is a biocide and kills the microbial pathogen within milliseconds of contact. This is called an oxidative burst pathway. Interesting, isn't it? So we have the process of phagocytosis. So the white blood cells absorb bacteria and the hypochlorous acid will do its job. What is the mode of disinfection, you will ask, and this question is relevant. Number one, it will be inhibition of the glucose oxidation, depletion of the adenine nucleotide, inhibition of DNA replication, and protein unfolding and aggregation. And now, exactly now, you will ask yourself, what is he talking here? This is exactly what we needed in the COVID time and in the, to get rid of the virus. Yes, this is why I'm talking to you, and I have chosen this topic for you today. We understood the generation of hypochlorous acid as an internal body product, but hypochlorous acid can be generated also using technology. So let's talk about the generation of hypochlorous acid. It is all about electrochemical activation, as you see, electrochemical water electrolysis. So it is a chemical process and it involves electricity. Wonderful. So what are we doing here? We are using electrochemical activation, and what? Guess what? We are passing a diluted saline solution, low concentration. Some will even use ordinary water to generate what? To generate so-called anolyte and catalyte. And if you research the science, you will come across, depending on your research mesh terms and depending on what you are looking for, you will come across on any of those those terms. Anolyte mostly, but this is what it is. So this electrolysis, I don't know, let me put this aside like this, even though, okay. Electrolysis of water is what's called a redox reaction, meaning electrons are being moved from one molecule to another, okay? And then we discussed the two existing parts, the cathode and the anode, cathode and anode, of course, and many publications are available already on the market discussing and praising the value of the technology, explaining generation, explaining application, and the benefits of. As you clearly can see, even recent publication 2020. So the source solution, as discussed, is sodium chloride water solution with no more than 5 grams per liter concentration. This is what we prefer. At the catalyte, so the product at the catalyte usually is a mild cleaning detergent and degreasing agent. Some will use this product for their purposes. Others will want to avoid generation of this product and will not want to have the product implemented. I will explain you immediately why, the preferences, and how is it possible to differentiate. The anolyte is basically what is the biocidal agent. So the catalyte is the detergent, while the anolyte is the biocidal agent. There are different devices described on the market. There is the Emerald, the Stel, the Aquachlor. Each of them has its benefit and its special application. For example, the Emerald is used for purification of drinking water, and not only drinking water, but also for swimming pools and so on and so on. The Stel is used in medical prevention and sanitary epidemiologic institutions. And of course, the Aquachlor, as already discussed, which has other components, which generates other components. So the most desired components at the anolyte are, of course, these disinfectant solutions. we will be able to generate, due to the different inputs, a more acidic annulate, a neutral annulate. In practice, initial solution is a solution of this sodium chloride in drinking water at a concentration not exceeding 0.5 gram per liter. You saw at the beginning that one can use up to 5 gram per liter. But the lower it is, you will see the benefits. Then we have, of course, the neutral annulate, and this basically has its big benefits for our use. This basically is the technology I have first time been introduced to. It was the so-called technology Sterilox. And this gentleman, we have to, he can be considered the godfather of all these technologies. Yes, you clearly see that this hypochlorous acid is an antiseptic. And Sterilox has been further developed, and one of the next generations I will talk to you and share, so you understand I'm coming from Sterilox. And then it moved further to the so-called single technology, and this single technology has the benefit that one of the greatest advancement, of course, is that you are free of chlorine. Okay, and you do not, without a byproduct of sodium hydroxide. Yes, I know, you still think that sodium hydroxide is the golden standard disinfection solution, but sodium hydroxide has a lot of disadvantages, which I will immediately emphasize to you. This technology has led to the development of more stable solutions. So single cell technology compared to the Sterilox, which I was introducing at the beginning, has the benefit of having a more stable solution. And you will want a stable solution because you need a constant ability to use the technology at its highest benefits. So, as already explained, there are different applications, and yes, this different in pH makes the solution, the byproduct, makes it usable and opens application in sterilizing water, cosmetics and clinical use, tap water, sterilizing water, and so on and so on and so on. The market is quite big, as you can imagine. Yes, you may ask yourself, so which door to open? There are even very cheap and solutions and technologies available on the market. Some will add salt. If you add salt and you will use this technology in your practice, you will end up with this, what I promise you, you will not want to have. So corrosion is a huge issue. Or adding vinegar, and then you will have, again, no reactive oxygen species. So a technology which is reliable and which has been identified as suitable in dentistry is the one which you will want to lean on and to use and to identify as usable for you. So what are the applications? For me, an important, I don't know, it is as important as the other application as well, but yes, dental unit waterline is an important issue in clinical dentistry. And it does not matter where you are on planet Earth. quality of water changes continuously, and you will not want, or you are familiar already with these happenings, which happened in 2016 in Anaheim with children infected after dental procedure. And we even have some losses there. So yes, it was described, the problem was described, infection in dental unit waterline. It will happen even in hospitals. And yes, we as dentists are very highly dependent of a high quality dental unit water to be safe, to guarantee safety to our patients. I don't know if you ever did look up at your, at your dental unit waterline tubes, but if you did, you may have seen that prior to using any disinfectants in your dental unit waterline, this is the way the tubes were looking. No, not a nice color, not a nice picture. And if you implemented dental unit water disinfection, then the pipes will really be filled only with this quality of water. So yes, there are studies published. This is a study published in 2017, as you clearly can see. And it is published, a case study, not in any country, but in Sweden, which is really a very advanced, has a very advanced standard. And yes, a man, an immunocompromised patient, and you never really know what the state of your patient. He died from a legionellosis at a hospital in Uppsala, Sweden. And this can happen, God forbid, of course, God forbid, in dental practices as well. This book, out of the series of British Dental Journal, Clinician's Guide, implemented this superb picture, and this is biofilm removed from a single dental unit waterline. And look what you have in there. I'm sure you do not want to be treated yourself or any member of your family with water coming from this kind of waterline. Just a question. Did you ever test in your career time, ever test the quality in your practice? If so, congratulations. If not, you should. You know, it's like working blind. You try to provide the highest level of science, of knowledge, of skills, of technology. But you have overseen an important issue. Water unit, dental unit, waterline quality. So yes, water is essential during dental care. A further paper published talking and discussing the issue. And further science, here it was a paper which identified a different technology to diagnose water quality. And of course, you will not want to see the bacterial genera identified, but yes, they found 233 different genera. As already discussed, this is a paper from 2018. Yes, it happens even in Italy, so in core Europe. And a further paper from 2011, wrapping all these together and giving more and more informations. And yes, believe it or not, it comes from India. And I know very clear that the problem there is also quite high. And I hope that the technologies available the price of the technologies will not hinder our colleagues to introduce dental unit waterline cleaning and disinfection in their practices for the safety of their patients. So what is the solution? Let's check it. So dental unit waterline, so from here to here, disinfection using hypochlorous acid-based disinfectant. So the hypochlorous acid clearly is a major solution to get rid of this possible bacterial infection. And a paper going back to 2016. So I introduced you first to the first technology I used and I was introduced to, which was these, as I said, Sterilox. And this is the technology I have acquired and the technology I am involved, I use, and I apply. Of course, prior to introducing and to starting using it, we have tested different possibilities. We have tested the solution. We have tested and wanted to understand the results. Yes, it is a single cell technology, so we don't have the byproduct of sodium hydroxide. It is a more stable solution, and we have a better control over the pH. So the solution, the technology this technology especially, which we decided to go for, gives us different options. Number one, it allows us to use the technology for the dental unit waterline, but at the same time, we can use at a different concentration, so the generated hypochlorous acid at a different concentration for other applications, which I will shortly introduce you to. So as I said, we have these two different buttons. One is for the water bottle for the dental unit waterline, and one is for the Ecasol, and I will show you the application which scientifically proven are used for this other product. So number one, and these are pictures taken in the praxis of in an Irish practice. Thank you very much, Anne, for the pictures. And it shows the application in the dental for dental disinfection, for dental unit waterline. And yes, you will want to know again to have confirmed the fact that this solution does not have any cytotoxicity, and this study confirmed the lack of cytotoxicity of this product. And you clearly can see here, sorry. And you clearly can see here that Ecasol presents a residual disinfectant in dental unit waterline output water and is very unlikely to have adverse effects on human oral tissues at levels effective in maintaining the output of the water quality. So not much more that you can ask for if you have this kind of scientific support for your decision. So again, in favor of the technology in a 2-year longitudinal study, again published in a high peer-reviewed journal with great results, and not just yesterday, but already 2009. And now it comes. Additional applications. Mouth rinse. You are told by your dental organization to use this and that and that. Are there really clear studies with high sensitivity and high specificity to advise you which is the best mouth rinse in this pandemic? Well, I doubt it. I did not manage to come to these results. We are in process of publishing a paper ourselves. It's already submitted. So in this paper, you will see that hypochlorous acid is harmless to the human body and has an extensive sterilizing power if used instead of, and yes, instead of chlorhexidine. So yes, congratulations to this research group. Now, in vivo toxicity and antimicrobial properties of electrolyzed oxidizing water-based mouthwashes. And voila, the results. Within the limitation of these studies, we concluded that both electrochemical activated waters, okay, contain so and so, and both showed similar mortality rates to medium, but little in vivo toxicity. So exactly what you are looking for. And of course, this is my love. You can imagine as an endodontist, and you remember my lecture in 2006 in front of the prestigious group, international group of endodontists gathered in Amsterdam. And I was talking about hypochlorous acid. And what are the purposes of any irrigation in root canal? From dentinal tubuli opening to disruption of, to disruption of adhesive biofilm, to debris and smear layer removal, and of course, disinfection. And talking about disinfection, yes, we will shortly be able to empower you with a technology to test the root canal disinfection prior to starting your obturation process. So electrochemically activated water produced markedly cleaner surfaces, removing the smear layer in large areas, okay? And as a conclusion, it can be considered to be superior to sodium hypochlorite. Wow, an interesting study. And yes, these are pictures out of that study, and the pictures speak for themselves. And even, guess what? The smear layer, okay? The smear layer, it was compared to EDTA, and you clearly see that even here, the benefit is big. A further study in regards to the toxicity of sodium hypochlorite, because this is the major point. We as endodontists are told or are using higher concentration of hypochlorous acid than the classic clinician. Some of us will use will even use 5% sodium hypochlorite and heat it up to make it more active, because it is a lazy material. And guess what? Hypochlorous acid showed even better or same results as hypochlorous acid. So again, saying that hypochlorous acid is the golden standard is an issue which deserves to be questioned. And of course, the difference lays in the detail. Why? because sodium hypochlorite has a greater effect on dentin micro hardness. And the higher the concentration, the higher the detrimental effect on dentin. So not only that we have a toxicity, but we have also what? We have also a negative effect on dentin microhardness. So the tooth is saved, but the strength of the tooth is heavily affected. Is this what we want? No. A further study to discuss, and it says that sodium hypochlorite treatment makes the tooth much more brittle, and it reduces flexural strength of the remaining dentin. Even more studies, and you clearly can see coming closer to our days today, 2019, almost similar results. And you know what? I was reminded by this Central American saying that says, if one person tells you you are drunk and you feel fine, ignore him. But if 10 people tell you you are drunk, go and have a lie down. So consider it twice. So where is the surprise? The surprise is that electrolyzed water has no negative effect on microhardness of dentin. So is there a question anymore? Not really. Some old root canal treatment performed by myself, showing even the healing in the area, and these teeth were exclusively touched by hypochlorous acid with other products, but no sodium hypochlorite. Again, same. I'm sorry you couldn't see the result. Here you see now the healing. And what about periodontology? Okay, here we go. Hypochlorous acid has both pro-inflammatory and anti-inflammatory properties. What? This means it attacks the gram-negative pathogens, it promotes healing, it modulates inflammation, and then, of course, it's suitable as a periodontal medication. So imagine you have this technology and you can use it, dental unit waterline disinfection. You can use it in perio, you can use it in endo. One technology serving all. This is not usual in dentistry. Of course, as I said, oral rinse, not to be forgotten. Even compared to chlorhexidine, yes, again. And yes, all these peri-implantitis cases, I would like to, yes, let me put this here. I'm sorry. So using, this is, I have to make a disclaimer, this is my invention, my patent, my product. It's called Reveal by Designs for Vision. It is a fluorescence enhanced diagnosis technology. And why is it the game breaker? Because it helps you identify biofilm contamination on the implant surface. And using disinfection solution in peri-implantology, you will be able, like hypochlorous acid, you will be able to help the patient and clearly control the result of disinfection. So hypochlorous acid is as an antiseptic may be effective for cleaning biofilm contaminated implant surfaces which you have detected using fluorescence enhanced diagnosis. And as I promised you, this will be in the future, meaning you will be able to use so-called dead life assays. These dead life assays, in combination with fluorescence enhanced diagnosis, will clearly empower you to understand and to diagnose the success of your treatment and the achievement of the full disinfection of the infected area. Yes, hand disinfection, a further ability. Oh, you will not want to read this because we are all advised and using alcohol-based solutions for hand disinfection in this pandemic, but we shouldn't, because alcohol is drying, has a drying effect on the hands. It can generate chronic hand eczema, lack of long-time effect against pathogen, and of course, it is not able to kill many different kinds of viruses. It has a short time effectiveness. All these are the studies we've mentioned this, and this is not studies from today. These are studies, as you clearly can see, which have been published over the decades. It can't reduce the spread of respiratory-borne virus bacteria. And of course, we know what happens with ingestion of alcohol. So, and yes, last but not least, maybe it is probably expensive and not widely accepted. And of course, you have to store it away from temperature and flames. So alcohol-based solutions, not anymore in my practice. What else? Hypochlorous acid, yes. And in addition, wound care, please, wound care. Yes, we generate and we are confronted with wounds in the mouth and sometimes even outside the mouth. In wound care, and this is a recent publication by a group of dermatologists in Germany, the use of hypochlorous acid containing solution positively influences the aspects of wound healing. And of course, we have to understand, and let us go again through that. We have an antibacterial, but also anti-inflammatory activity using hypochlorous acid in these cases. And I'm sure you was waiting for this. And here it comes. It's the topic of surface disinfection. Because the very same technology I have showed you is able to help you disinfect the surface in your whole room. And look here, whole room atomized disinfection used in tandem with manual terminal cleaning protocols improved disinfection outcome. So yes, it is a hot topic and of highest interest for us. But how exactly? You know, we are all doing for so many years, so often during the day, we do this disinfection and we use these technologies because we were told to use this. Have you ever considered testing what you are doing and checking for the outcome, for the solution? Well, you know, I prefer to take my decisions myself, you know. I believe that the education we have been granted should empower us to take our decisions ourselves and not to use Oh, I have been told to do this. So we use this excellent technology, this Lumitester, produced by Kikkoman, and we did dental chair and surface disinfection, okay, using the solution, using Dentaqua and Ecasol. Yes, I can bore you explaining what this technology is. I'm sure you are not interested in that. But yes, clearly this technology is able to identify contaminants in medical facilities containing ATP, ADP, and AMP. So one could clearly test and identify door handle, remote control, bedside rails, PCs, card, touchpad, touch panel, and so many other things using simply this technology to check it. So what have we done? We did the following. We swapped the dental chair touch membrane after patient procedure with this technology. We identified the contamination using this Kikkoman result. It showed us a certain value. Then we used the hypochlorous acid generated by Dentaqua, the Ecasol technology. We just did the very same with the dental chair. And we came then, we concluded and made our own results. And here identified our own results. And here are our own results. So before, okay, value of 43 up to 298, depending. But after use of spray and paper towel disinfection, so no additional alcohol wipes. Yes, this saves a lot of money. The results are concluding 0, 0, 0. And we did several tests, and our results continuously proved the very same, the very same 0, 0 values. So meaning you have your Ecasol technology or Dentaqua technology, you generate your solution, you choose which concentration you want, either for the water bottle or for the room disinfection, and then you simply use it accordingly to, you can spray and then use dry paper towels to disinfect, to get your disinfection. So the benefits, hypochlorous acid is the solution, antimicrobial, antiviral, antifungal, and non-hazardous for oral mucosal contact. It reduces skin aging, makes blood clot in wounds, causes fibrinogen oxidation, stimulates immunity to germs, and of course produces powerful local stimulants of wound healing and germ killing, new skin cells, leads to long-lasting effects in the body. So again, remember, hypochlorous acid is an endogenous substance that all mammals can accept in low concentration. And of course, it is very affordable. It is powerful in killing different types of organisms, okay? And it is even used for human atopic dermatitis. This says a lot. Another paper clearly showing that disinfection with sodium hypochlorite and hypochlorous acid have similar disinfectant efficacies. So the question of having a cytotoxic product is no question anymore. And yes, last but not least, what is very important to identify is the costs and risk reductions using hypochlorous acid as a disinfectant in the dental practice. And now some publications on the topic of hypochlorous acid, which our group did by themselves. I'm grateful to Professor Giampiero Rossi Fedele, to Professor Jose Antonio Poli de Figueredo, and please, if I may have forgotten the others, please, and not named them, I apologize at this stage. But yes, again, we use it. I used it and continue to use it for many, many, many years, exclusively for the root canal disinfection in my practice, and the results speaks for themselves. Some of the papers, as I mentioned, yes, I will not bother you with them. You can surely find them yourself and check. And what is very important is to understand also the interaction with the different other solutions. And yes, I very much prefer the electrolyte, the hypochlorous acid to sodium hypochlorite from its effect and its side effect clearly. And there is no need to discuss stability of a solution. Most important, if you can use a fresh solution which you produce on the spot. So points of interest. The point of care production is important to support stability, and of course is by this different to ready-made hypochlorous products. I hope you enjoyed. It was not too boring for you. I would like to thank you very much for your care and attention. This is my email address. Should you have questions for me, and please feel free to contact me at any time. Thank you very much. And yes, if there are questions, I am happy to discuss and to answer.
Sir, now we have a few questions for you. If you permit, shall I proceed?
Please.
Sir, what's the effect of hypochlorous acid on dental equipment?
This is a very good question. Thank you very much for asking that. I showed you, if you remember, that picture of the handpiece, of the connection, okay? It is important to be very careful which kind of hypochlorous acid you are using, how was it generated, concentration, and no additives like vinegar or too high level of salt, and the pH is most important. You have to use a neutral solution. This is why we, as such, we have focused on one technology we have explored in depth and could say this technology I can recommend as I use it and I am happy with it.
Okay, sir, move to the another question. Can we use hypochlorous acid fogger to disinfect gowns and masks?
Gowns and masks, the disinfection using, well, you can. Answer is yes. The question is, how will you use it? How long to apply it? If you ask this question and you want a good result, you will want to check it, and I clearly recommend you, I'm sorry, I know money is important, but you need a technology in your hands to check the result of what you are doing. So I like very much this Kikoman ATP technology and use it, and you will find yes. But yes, the answer is yes.
Okay, sir. The last question of the day is, what's the role of hypochlorous acid in apical surgery?
Bravo. Wonderful question. Congratulations to the one who asked it. In my world, I would love to use, and I have done it, and I did it. I have replaced and put hypochlorous acid, the same hypochlorous acid I have used for the irrigation as an irrigant in apicoectomies. Yes, good question. Bravo. I like it.
With this, we come to the end of the session. I would like to thank Sir for the wonderful presentation and also thank Dr. Anmol ma'am for organizing this webinar and my co-host Dr. Anu ma'am. I would like Dr. Anmol Bagaria ma'am to conclude the session with a few words. Thank you.
Thank you.
Good evening, everyone who are present here from India and all parts of the globe. I would thank Sir for giving us his valuable time this evening. Sir, it's our honor and privilege having you here today. Thank you for enhancing our knowledge and skills. So thank you for giving your valuable time to us this evening.
Thank you very much. My very best wishes to everyone. Please stay healthy and take care. And always do not forget it is a privilege to be allowed to treat patients. So act accordingly. My very best. Bye.
Bye, sir.